Introduction to Substance Misuse. Introduction to the module. Substance misuse is a common term, but different from substance addiction. In this module, you will learn the basic sectors of substance misuse. Topics to be covered. What is substance misuse? Commonly misused substances. Substance use and misuse. Abuse and addiction. Substance use disorder. Signs of substance misuse. Behavioral symptoms. Physical symptoms. Psychological symptoms. Reasons behind substance misuse. What is substance misuse? Misuse of a substance is the use of alcohol, illicit drugs, or over-the-counter or prescription drugs in such a manner that they are not intended to be consumed and may be dangerous to you or those around you. People may use drugs once, rarely or daily, and they may continue to experience drug use disorder. A disorder of substance use happens when alcohol or medications impair your fitness or how you act in your everyday life. Substances can be something you insert into your body and can affect the way your brain works. These changes can affect your perception, mood, thinking, behavior. Commonly misused substances. Commonly misused substances include alcohol, including beer, wine, and distilled spirits. Nicotine products, including cigarettes, cigars, e-cigarettes, and smokeless tobacco. Marijuana, including synthetic cannabinoids, such as synthetic marijuana, K2, and spice. Drugs, such as heroin, codeine, oxycodone, oxycontin, morphine, hydrocodone, Vicodin, fentanyl, and hydromorphone hydrochloride. Benzodiazepines, including diazepam, Valium, lorazepam, Ativan, alprazolam, XANAX, and clonazepam, Klonopin. Over-the-counter cold or cough medicines. Other substances, including cocaine, amphetamines, methamphetamine, and other stimulants. Misuse is not inherently limited to one substance. Polysubstance usage refers to consuming, at the same time, more than one drug. This could be deliberate, such as combining a drug with alcohol to intensify the effect. Substance use and misuse. Numerous experts agree that the line between drug use and addiction blurs as prolonged use affects particular life facets. For example, if daily use results in one of the following, the person is likely to have a drug abuse problem. Health complications as a result of substance abuse. Inability to carry out daily responsibilities. Physical dependence. Withdrawal symptoms if usage stops. Cravings for drug or alcohol. Drug misuse can also lead to substance abuse, although this is not necessarily the case. Drug addiction and drug abuse are not the same. Abuse and addiction. Addiction doesn't begin overnight. It takes time to gain tolerance for the drug of choice, develop cravings for drugs, and suffer complications related to the use of controlled narcotics. Drug misuse always begins first. The symptom is the failure to resist the use of drugs and alcohol. Someone who deals with substance abuse may have many issues that affect those with addiction, but may be able to avoid consuming all drugs without problems for a long time. However, an addict cannot stay away from his or her choice of drugs and other substances despite a strong urge to stop using them. Substance use disorder. A disorder of substance use happens when the use of alcohol or another substance, drug, causes health complications or problems at work, school, or home. This disorder is also called substance abuse. The precise cause of substance use disorder is unspecified. Some causes may be genes, drug action, social control, personal pain, fear, depression, environmental stress. Many people who develop drug use problems have addiction, attention deficit disorder, post-traumatic stress disorder, other psychiatric problems, stressful or unstable lifestyles and poor self-esteem are also widespread. Children who grow up watching their parents take drugs may have a high chance of having substance use problems later in life for both environmental and genetic factors. Signs of substance misuse. Identifying the symptoms of addiction is the first step in helping yourself or leading those you care for to rehabilitate. It is also crucial to provide an awareness of the symptoms of addiction. There are behavioral, physical, and psychological symptoms of addiction. Behavioral symptoms. Behavioral symptoms include a person's external relationship with the environment, while medical signs refer to the appearance of side effects by the body due to the existence of substances in the system. Behavioral signs include, but are not limited to, obsessive thoughts and action. In this case, acquiring and consuming drugs are the key goals in life, while any other responsibilities, including job, family, or education, are ignored. Disregard of harm caused. Since substance misuse causes physical and mental trauma to individuals and their loved ones, a person dealing with addiction tends to use narcotics or alcohol. Loss of control. Even in the face of wanting to stop or reduce their drug use, the person cannot do so. Staying in denial. When approached, the person struggling with addiction will reject or reduce the use of drugs. To escape having to justify themselves to others, a person will do drugs in secret. Drug misuse cannot stay secret for a long time. Its effect is too drastic, and people who use drugs will quickly spin out of control. Physical symptoms. Physical symptoms of addiction can manifest as side effects of use, overdose, or as a result of withdrawal. It can be very difficult for anyone to identify the clinical symptoms source, but serious consequences may require emergency medical attention. Physical signs of addictions are enlarged or small pupils, sudden weight loss or gain, bloodshot eyes, insomnia, unusual body odors, poor physical coordination, looking unkempt, slurred speech. Signs of overdose are drowsiness or trouble walking, agitation, aggression or violent behavior, difficulty breathing, nausea and vomiting, hallucinations, delusions, loss of consciousness. Withdrawal symptoms may include shakiness, trembling, and jumpiness, loss of appetite, nausea and vomiting, depression, insomnia and fatigue, headaches and fever, confusion and hallucinations, seizures. Psychological symptoms. Drug misuse also affects the psychological status of the victim. If they are in the grasp of addiction, the individual does not know or notice these changes. Psychological signs are anxiousness, inattentiveness, lack of motivation, irritability or angry outbursts, changes in personality or attitude, emotional and mental withdrawing from people, sudden mood swings, unexplained paranoia. Reasons behind substance misuse. Different types of substance abuse can arise for many different causes. Although each addiction is different and the severity may vary from drug to substance, there are several general causes people can become addicted to the substance. The causes are depression. Many people who are struggling with depression do not get adequate medication for this issue. Many coping with depression appear to self-medicate the effects of depression with alcohol, marijuana, cocaine, and various other mind-altering drugs. Fitting in. Peer pressure encourages people to do things they wouldn't have done, either to appease their peers or to want to be appreciated. Self-medicating. Stress, fear, recurring discomfort, undiagnosed psychiatric disorders, extreme depression, isolation, trauma are some responsible for addiction. These are all the reasons that people will be self-mediated by mind-altering drugs to deal with what they feel or don't want to feel. Curiosity. Often, people feel curiosity towards substances, which later on leads to substance misuse. Prescribed medication. Some people believe that, when a doctor issues them a prescription, the drug they are taking is healthy to take without any effects. Unfortunately, addictive substance medications are highly toxic and can serve as a pathway to other drugs, such as heroin. Summary. A disorder of substance use happens when alcohol or medications impair your fitness or how you act in your everyday life. Drug misuse can lead to substance abuse. However, drug addiction and drug abuse are not the same matter. An addict cannot stay away from his or her choice of drugs and other substances, despite a strong urge to stop using them. Children who grow up watching their parents take drugs may have a high chance of having substance use problems later in life for both environmental and genetic factors. Each addiction is different, and the severity may vary from substance to substance. Thank you. This is the end of this module. Thanks for watching. Happy learning.